All right, welcome back. When making the decision for assisted weight loss programs, there's a difference between medical weight loss and surgical weight loss. And here to give more information on how to choose what's right for you is Dr. Peter Lalor, right here, a double board certified bariatric surgeon from Wood County Hospital. Double board certified, that just sounds important. I don't even know what that means. What does double board certified mean?
Well, board certification is a certification that most doctors get in their certain specialty. I was first board certified as a general surgeon, but with obesity as the epidemic that it is, we decided to go back and get double board certified in obesity medicine as well. So it's both the surgical side and the medical side.
And you're, I know we want to talk about this, but to me, you have a fascinating story. In Ireland, wasn't it, where you first were trained medically?
Yep, I grew up in America. I'm Irish-American heritage. I went to college out in New England and then decided to go to medical school in Ireland because of my background. And after medical school there, ended up back in America in residency, and 25 years later, I guess here I am now.
Sure, at Wood County Hospital. And let's talk about this particular type of surgery. This is a big decision for people, right? Because there's choices here. Do we go through, the exercise? Do we go through the medications that are out there now? Some people don't necessarily have that option. When do they come to see you?
So from a surgical standpoint, surgical weight loss programs are usually designed for people that struggle with a large amount of obesity, meaning they're 80, 100 plus pounds overweight, and those are the surgical options that have been shown to be the best solution to fight this obesity chronic disease that we have. For people that are more on the 20, 30, 40, or 50 pounds overweight, we have medical weight loss options for them. And that kind of differentiates which pathway you may go.
What do you see happening? You've been in the business for decades, right? You've been taking care of people for decades now. What have you seen maybe lately that you didn't necessarily see 25 years ago? So
the surgery's evolved over time, and we've narrowed it down to a few minimal invasive surgeries that work very well for the right candidates. But in this day and age, with the technology and the research that's been done, the medical side of things has really taken off, as many of us know. There's certain anti-obesity medications that people are learning about. Including the shots that everyone talks about,
right.
The GLP-1 agonists, which is a huge topic. And so the technology and the medicine has basically gotten better over time, but still not quite at the level of surgery.
Well, and here's the other thing, too, is that people think about the actual medicine, the shot, the surgery, but it's the post-op, post-medicine, post-shot, right? That's just as important, if not more.
Yeah, and I think what you're getting at is the whole program. And whether it's medical weight loss or surgical weight loss, it's really the comprehensive medical or program, multidisciplinary program, where people are going to be most successful, when they're talking about lifestyle interventions, behavior modifications, meeting with a dietitian, talking about exercise, and of course the mental health component with a behavioral therapist, as well as all the, the invasive nature, what you need for surgery in terms of vitamins and things like that, or even the issues around with taking a medication, which can have side effects and interactions with our medications as well.
And your office down there at Wood County Hospital, that provides everything from step one to all the way through completion and into post, correct?
Absolutely, and you did, to elaborate more on the post aspect of things, these are lifetime changes, and patients, whether it's medical or surgical choice that they make, they have to be committed to this, not up front, but in the long term, and we try to help them with that.
And you do a great job, and your office staff, I'm sure, hyped up that you're here to talk about your work here. If people need more information and maybe a way to contact you, what would be the best way to do that?
Yeah, probably our website, woodcountyhospital.org, and certainly we have a presence on the internet as well.
That's Dr. Peter Lalor. Thank you so much for doing what you do, and appreciate you. And again, we shout out the office staff down there at Wood County Hospital.